Doctors of Reddit, what basic pieces of information do you wish all of your patients knew? That looking up information does not equal incompetence or the visit being a waste of time when you could just use the internet. It makes a lot of difference when you know what to look up, only use evidence-based sources, and know how to interpret it. The importance of not overprescribing antibiotics. Yes, I know you're sick, but there's no magic pill for the common cold. I'm astounded by how many people don't understand the difference between viral and bacterial infections. Not the named symptoms, just that they're different things, and antibiotics fight one of them. As doctors, we are tied by a lot of ethical and legal red tape. There are many things we wish to do but cannot do it because we would lose our license. Things that don't make sense. Things that impede you. Things that annoy you. We are bound to do them in order to 1. Get paid. 2. Keep practicing. Like the friggin' depression anxiety questionnaires I have to fill out every time I visit my GP. My therapist and psychiatrist are dealing with these issues. No need for you to intervene. Actually, please don't intervene. I don't want two doctors trying to manage the same medications. 1. Basic self-care. For minor and self-limiting problems. 2. The difference between a drug allergy and intolerance. Penicillin might make you fart like a trooper, but it is not an allergy. 3. The flavor of the month diagnosis circulating the net media is often either stonkinky rare or questionable. View with a healthy degree of skepticism. Basic info about yourself. What meds do you take? Oh, the little white one? You've been taking it for 10 years. How do you not know what you take? Also, don't put accelerants on fire. Cancer is not a disease but a family of diseases. The type of cancer you have is based on the original cells that mutated and began uncontrollably reproducing, not where the tumor is located. Breast cancer that has metastasized to the brain is still breast cancer. Different types of cancers respond to different treatments, so that treatment that did wonders for your co-worker's cancer is probably meaningless for your mom's. Chemotherapy is not one drug or even family of drugs. Technically it means the use of any drug to treat a disease, but has been popularly used for medications and cancer treatment. So different people can handle chemo very differently because they're on completely different drugs doses. And of course different people also react to the same medication differently. Everybody is different is now a tagline in our home. Wife finished treatments a short time ago. How much time, money and effort we have put into our training. Trust us. We are not medical encyclopedia but sieves. We look up crap all the time. Not because we're dumb bad, but because you literally cannot have all of medical knowledge at your fingertips and have to use your knowledge to know where to look for the correct and reliable information. TLDR. My MD trumps your Google. Trust your doctor and work with them. Tough to trust a doctor that doesn't wear shirts. Your genitals are probably normal. Don't worry too much about what I'm going to think of them. And don't wash your vulva with soaps. Also learn what a vulva is. Depression and anxiety and mental illnesses are real illnesses. So when I ask for your medical history, don't leave out your depression. And don't not mention your antidepressants because you know they're not relevant when I ask what meds you take. Things interact and depression is no less a real illness than diabetes. Nurse here. When we walk into your room and ask how you are, we genuinely want to know. It's the one time in your life you can feel free to answer totally honestly. Please don't say you're fine and then 3 hours later mention you've been having chest pain all day but didn't want to bother anyone. That this isn't a freaking McDonald's. The customer isn't always right. I'm not giving you X just because it's what you want when Y is what you need. If you can't accept that, then you'll have to seek care elsewhere. Edge like a goddamn scalpel. Preach it, doc. Not a doctor, student nurse. I wish my patients knew that hitting me and throwing objects body waste off of me will not get them their own way and everything I do is in their best interest. You. So sorry. Medications they're taking. Also, bring your medical records. It's hard to guess what the MRI or CT scan reported when you had it 2 months ago. It saves a lot of time to have it and make a decision and start treatment, and the list goes on. Whenever I see a new doctor, I literally bring a bag of my medications with me. I take too many medications to trust myself to remember them all. Pharmacy student, not a doctor, but I feel like these are still pretty applicable. 1. Most medications will not magically cure you overnight. Give it time. They also won't work properly if you don't take it as prescribed. 2. Your 10-year-old prescription is not valid, especially if the doctor that gave it to you is now dead. 3. Know what is going on with your insurance. Everyone has different insurance, and for the most part they are all equally horrible to deal with. Save us all some trouble and have your current insurance card ready to go. Know what your deductible is, etc. 4. Your pharmacist does not set drug prices, and if your insurance company decides they're not covering something, there's really only so much we can do. Do not get mad at us because your medication is expensive or because your insurance sucks. What medications they take and why, and their medical history. Your blood pressure isn't high anymore because you take 3 medications to control it. If somebody asks if you have high blood pressure though, the answer should still be yes. And obviously some of this has to come back to us as doctors. If I never took the time to explain to you that this medication is to treat your cholesterol and just gave you a prescription, that's on me. I am not hereby hired to you for life as a full-time consultant after you or your family members visit. No, I will not sit on the phone with you for 40 minutes for free giving you the rundown of your son's visit that you did not bring him to. I wish they knew that their bodies heal themselves. Not everything requires an intervention. Sometimes a little rest is all they need. That's why people I know go to the doctor, to get a doctor's note so they can get a few days off work so they can rest. 1. Stents don't prevent heart attacks. 2. Statins do, more than anything other than quitting smoking. 3. Antibiotics won't help your cold, and probably won't help your sinus infection either. 4. There is a 99% chance that nutritional study you heard about in the news is bulls, and the other 1% of the time the results are being misinterpreted. 5. Lots of things cure obesity in diabetic rats. 6. You probably don't need a multivitamin. 7. Vaccinate your kids, damn it. 8. Waiting is a medical therapy, sometimes the best one. 9. VIPs actually get lower quality medical care. 10. There will never be a cure for cancer because cancer is thousands, maybe millions of different diseases. 11. Everybody knows how the C wound up in your urine. 12. Your doctor would rather know if you don't take your medicine than have you lie about it. 13. If you're an alcoholic and you get admitted to the hospital, be honest about how much you drink. It could save you a life-threatening withdrawal. 14. If you're a married man, bring your wife to your appointment so someone will be there to give actual medical history. I grew up in a family of doctors. If you go to the ER because your throat hurts, you get laughed at while we eat dinner. 1. Just because you are smart and are a patient does not mean you know more about medicine than your medical provider. Similarly, just because I am smart and own a toilet does not mean I know more about plumbing than a plumber. And, as I've learned the hard way, the internet guided DIY approach doesn't always end well. 2. Antibiotics don't treat viruses. Colds are from viruses. 3. If your child has the sniffles, send them to school instead of the doctor. 4. Fevers aren't bad for you. Whatever's triggering your body to mount a fever might be bad for you. Treating a fever with ibuprofen or Tylenol does not treat the underlying trigger. 5. Birth control pills don't prevent STDs. 6. Hospitals aren't hotels. Apologies for not having the nicest soap and the quietest rooms. The money from your insurance and the hospital's philanthropists is instead spent on things like having properly trained pharmacists and the drugs that treat your condition. 7. Opiates are reasonable but not perfect at controlling acute pain. In this setting, it's hard to get addicted. Opiates are pretty bad at treating chronic pain. In this setting, it's easy to get addicted. There are not great options for treating chronic pain. Reconsider what you want out of life before going down the opiate rabbit hole for chronic conditions. 8. Weed isn't great. It's safer than a lot of stuff that's more readily available, but that still doesn't mean it's good for you. 9. If you show up to an appointment and can't be seen for another 20 minutes, it's not due to some personal vendetta against you. It's because a patient before you was unusually sick or complex and needed more time. If you were that patient, You'd probably want your doctor to spend more time with you as opposed to cutting you off. 10. There is not a medicine for everything. Also, I cannot tell you the exact date at which you will be discharged from a hospital because I am not psychic. Happy to guess. Might be way off. Antidepressants will not make you suicidal. When someone takes an antidepressant, their energy will usually increase in about 1-2 weeks while their mood may not lift for 4-6 weeks. Someone who is already suicidal may use it increase in energy to actually go through with it, not waiting the extra couple weeks for mood relief. The medicine does not randomly cause suicidal ideation. Thank you for explaining this. I always wondered about that warning. Nurse here. 1. That I'm not a freaking pharmacy. You wouldn't believe how many parents' family members are like, oh, I have a headache. Can you get me some Tylenol? Sure. I just have a giant jar of Tylenol I can hand out to non-patients. Nobody tracks that stuff and it definitely doesn't cost money. 2. A hospital isn't a hotel. I mean, these days it is, but still, just because your child is admitted does not mean your 11 other children are free to stay 24/7. I am not obligated to feed them, give you free diapers for them, watch them while you disappear for 3 hours, etc. My job is to take care of your hospitalized child. That is all. Number 2 is my job. I'm the social worker. Sorry, I'll get on it. Not a doctor but a paramedic. If you're going to the emergency room, you are not going to be seen by your primary physician. It doesn't matter that your doctor is at the hospital 10 miles away. Even if we take you there, you're going to see a physician. Go to the closest facility. Also, if you take medication and it corrects a medical condition, you still have that condition. It's just controlled. Don't tell me you have no medical problems, then hand me a list of medications. Second, also, there is a difference between medical history and surgical history. If you're having chest pain, I don't really care that you've had your knee replaced and back surgery 10 years ago. I very much care if you've been diagnosed with an aortic aneurysm or had an MI before. I disagree with your second statement. As a medical professional, it is your job to drag the information out of the patient. No matter how frustrating you find it, you cannot expect an untrained layman to know what is relevant information to you. Nurse here. It is very obvious when you are just trying to get meds. You're not being clever. You're not being sneaky. You are being painfully transparent. I am a doctor, a bacteriologist, not an MD. Here is something I wish more doctors understood. Antibiotic resistance does not develop in patients or hospitals. It is the result of selective pressures resulting from massive agricultural abuse of antibiotics in order to make more money by crowding animals together. Restricting antibiotic use will not prevent the clinical development of resistant organisms. Resistance will continue to develop as long as we allow agribusiness to dump tons of the latest antibiotics into animal feed in order to make more money. We know that you are not truly allergic to Toradol, Tramadol, Tylenol, all NSAIDs, and morphine, but can tolerate that one with the D just fine. You'll get further just telling me you need a fix. I'm probably not gonna play ball, but I just might. Honest is appreciated and don't waste my valuable time. The medications they take, who their doctors are, the definition of nausea, the difference between lightheaded and dizzy. That's just a sample size of the things I be about internally when I see patients. Usually, if a doctor is concerned about something and is giving you a warning about it, it's not for funsies. As a general rule, we got into the medical profession to help people, not because we like being bossy for no reason. So stop being preoccupied with your chronic constipation that you have had several colonoscopies for and don't want to stop your opioid medications for, and pay attention to your sleep apnea, that is going to kill you quicker, and puts you at risk of heart attack and stroke. And if you don't like hospitals or doctors, try taking your insulin for your out of control diabetes that has already caused Charcot's deformity in your feet and mild renal impairment. You are looking at leg amputations and dialysis, in hospital, 3 times a week, 4 hours at a time. If you don't stop trying to bargain with me about your insulin regime, you aren't bargaining with me, you are bargaining with your body, and your body doesn't do deals like that. Obligatory, not a doctor. Patients need to know that if they have a common cold, no amount of antibiotics are going to cure it. Just go to bed and drink lots of water. not a doctor, but an EMT paramedic student, unless you are dying, or could die from whatever ailment you are suffering from in the next 5-10 minutes. Going by ambulance does not mean you will be seen immediately in the ED. Emergency department see patients based on the severity of what's wrong with them, not who got there first. For example, say there are 10 people in the waiting room with common complaints: upset stomach, nausea, vomiting, for example, and a person arrives by ambulance with a similar complaint. The ambulance patient might have to wait anywhere from 15 minutes to 5 or 6 hours. Yes, you did read that right. To be seen, simply because other folks might be worse off than them. But if that same ambulance patient is coming in due to a heart attack, stroke, severe trauma, or other life threat, then they'll get seen in a flash. This is a big part of why it takes so long to get seen at an ED. Folks coming in with things better handled at an urgent care clinic or their primary care doctor's office. I've been an EMT for 4.5 years, and for every serious "this dude's about to die" patient I've wheeled into an ED, I've taken in a few hundred folks might have been better served by going to an urgent care center or their normal doctor's office. Don't eat so many drugs for everything. Every cough, rash, runny nose, sneezing are the reason for taking a pill. No, they are not. Low pain doesn't need painkillers. Be careful with supplementation, because most of it is bulls and most people don't need anything more than reasonable diet. Exactly, people just need to get healthy and it will prevent 90% of healthcare necessity. Optometrist, your eyes are a part of your body and as such, can be affected by your systemic health. Don't get pissy whenever I ask you what medications you take or what your medical health is like. I'm surprised that no one put the "don't eat before surgery" anesthesia. Oh wait, people know that but not why, and they don't follow through it. EMT, our ambulance isn't a frickin' taxi. If you can walk out to us or can have someone drive you because it's not all that urgent, do it. Healthcare in the US is way too expensive. Like literally only call for an ambulance if it's bad enough of an injury. That taking an ambulance is obviously a better choice. I'm not trying to be a dong. I just don't want to bankrupt you for only giving you some Zofran and some saline. Not a doctor, but I work in daycare. I really wish that parents knew that teething does not cause your kid to run a temp of 101 or higher, and your kid isn't teething if they have all their teeth. Threatening doctors and nurses will not assure you get the best care possible. Constantly reminding people that you are a lawyer is, however, an excellent way to make sure that all parties involved avoid your room unless absolutely necessary. The effect being that if we can discuss your case and don't need to do a physical exam or find specific information from you, often wheel round and make our plan without seeing you because we don't want to risk pee you off. Also, do you really want a person operating on you to resent you when they are closing skin where scar formation happens? Or when it comes to deciding if they should prescribe pain meds first or get lunch at 4 PM? You can't sue for everything we do to make your experience better. Constantly telling people a lawyer will get you the best medical documentation money can buy. Medical care, not so much. I know this is gonna sound insanely effing pretentious, but we know way more about the human body than you can even imagine. Like seriously, right down to an ionic level. It gets seriously annoying when someone Googles their symptoms and thinks they know more than you. Just let the doctor do their job. The doctor knows more about the disease, its signs and symptoms and its treatment more than I, the patient. No, nowadays the patients come saying, "I have this disease." I mean, did WebMD tell you that? Just tell me your compliance. I'll decide what you have. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.